Over to you, Wendy.
You're going to say hi, Marc?
Yes, hello everyone. Hi, my name's Marc. I'm the services manager for Arthritis Action. I used to be a personal trainer and sports massage therapist, and I'm joined by Dr. Wendy Holden. So you can introduce yourself.
Hi
Wendy.
there. Thank you very much for coming. Hope you all had something to eat. I'm a consultant rheumatologist based in Hampshire, and I'm medical advisor to Arthritis Action. So thanks very much for joining us tonight. So first of all, here's an outline of what we're going to talk about. So we've been asked to provide an introduction to arthritis. So I really hope this isn't going to be too simple for anyone or too complex. Feel free to ask questions if anything feels baffling or if it's too simple. So first of all, I'm going to just cover what do we mean by arthritis, touch on the different types of arthritis, and then I'm going to talk about medical management, which is hopefully fairly brief. Very relevant to lots of the clients that you see will be various myths around arthritis, which I'm gonna cover. Lots of questions that people often ask. And then Marc's going to cover exercise and activity and nutrition, which are his special areas. And then I'm just going to touch on the meaning of pain and arthritis. And then Marc is going to talk about what we do at Arthritis Action. And hopefully you will be able to refer some of your clients to us. And we would like to engage with you a lot more, hopefully, in the future. So let's kick off with what is arthritis. So arthritis is derived from a couple of Greek words, arthritida, I think it is, arthra, meaning joint, and itis, meaning inflammation. So it really just means pain, stiffness, and swelling in any joint, really. It can affect anybody, really, at any age. I mean, most people think of arthritis as an older person's condition, which would be typically osteoarthritis, but it can occur at any age, even in very young babies. Loads and loads of different types of arthritis, so it's quite confusing really for lots of different people. And the thing with arthritis is it's not just pain and stiffness. It's not just a painful finger or a painful toe. Many people with arthritis feel quite unwell. They feel tired. They often feel low or anxious because they're struggling to do their jobs, and they often have a lot of sleep problems as well. So it very much is not just a pain problem. It affects people in every area of their life, really. So I got a few different pictures up next about different types of arthritis. And so these are the two broad categories, really. So we've got inflammatory arthritis and we have non-inflammatory arthritis. So it's quite simple if you think about it in those kind of terms. So non-inflammatory arthritis would be what we probably know best as osteoarthritis or wear and tear. And that typically affects us as we get older, often affects the small joints of the fingers, and in the context of your practice, the big toes most commonly, and of course the knees and the hips, the most common reason for people needing a hip or a knee replacement. And this is traditionally called wear and tear arthritis, although as I explain later on, that's probably a misnomer. Then we've got inflammatory arthritis, and the best known type of inflammatory arthritis would be rheumatoid arthritis. And these hands on the right, you can see this is a young person's hands. And in this, you can see the swelling of the, I don't know if you can see my arrow, you probably can't see the arrow on there, but swelling of the joints, the knuckle joints, the big metacarpophalangeal joints, and then the next joints up. So that would be typical of a person who has rheumatoid arthritis. An inflammatory arthritis, what happens is the immune system goes wrong and starts to attack the joints. So this is an autoimmune condition, just in the same way that thyroid problems or diabetes is an autoimmune condition. It's just that the immune system is attacking the joints. And in order to deal with this, we have to attack the immune system back. Most people with rheumatoid arthritis would need some form of medical treatment for their condition, and they'd usually be under a rheumatology department. So the next slide just shows a few more examples of different types of inflammatory arthritis. So big picture on the left, you can see this young fella has got very swollen ends of his fingers, and if you look carefully you can see that his nails are damaged as well. And this is somebody who's got what's called psoriatic arthritis, or arthritis connected with psoriasis. Now, the trick here is that you can have psoriatic arthritis. It's connected with the skin condition, but you don't need to have psoriasis in order to have this condition. This condition commonly affects the joints in that way, so it causes swelling of the end joints there of the fingers and the toes. That person would probably have affected toes as well. If you have someone in your family with psoriasis, it's adequate for you to have this condition. So if you see anybody that's got a slightly funny looking toe like that, a young person with a funny looking toe, ask them if they have psoriasis or if anyone in their family has got psoriasis, and you will get some very surprising and illuminating answers. And if they're not under the rheumatologist, they most definitely need to be. So that's a helpful signpost as well. Okay, so no prizes for that one. The top right, that's obviously big toe gout, which is hot, red, and swollen, as you probably know. And then the joint below is gout affecting the thumb. So lots of people are not aware that gout can affect many different joints, most commonly the feet, of course, but it can also affect the finger joints, knees, ankles, wrists, and many other different joints. Okay, and the next picture is, okay, what have we got here? So the top left picture, this is one of my patients who, as you can see, she's got very deformed hands, and this happened within a year. This lady has rheumatoid arthritis, and she refused treatment for her arthritis. And this is what happens if you ignore it for a year. With damage can happen very, very quickly. Surprisingly, her hands don't hurt very much, which is why she didn't really want treatment, but the hands certainly don't work very well anymore. And this picture on the right, the top right, you probably have seen some feet like that and recognize that that's 2 feet with rheumatoid deformities in the feet. Obviously can be a very, very painful condition and debilitating. And then the last one on the bottom, a young person's hand, and you obviously can see that the deformity is severe, but it doesn't affect all the fingers. And that would be another example of a type of arthritis called psoriatic arthritis. So it can sometimes look like that. So that person probably does have psoriasis as well. Now, the next one, just nearly finished with the pictures. Just a couple of things for you to look out for in your clients. So if you see anyone who's got slightly funny nails like that, that's called onycholysis, and that's where the nail bed separates from the nail separates from its bed. And the middle picture showing lots of ridges and pits. So those are both nails typical of someone that's got psoriasis. And it's worth looking elsewhere in people who've got swollen joints to see if they might have a telltale patch of psoriasis somewhere on their arm or elbow or in their scalp as well. And that could be a pointer to what's going on. If they've got painful joints, particularly in their feet, they may well have psoriatic arthritis. So please refer them if they haven't or are not already under the care of a rheumatology team. And then the last two, another example of inflammatory arthritis. Next one, Marc. So you've probably all seen somebody occasionally coming in with swollen toes like that, and you probably know that that's dactylitis. And that's another example of something that can happen with inflammatory arthritis, definitely not normal in a young person's toe. And anyone you see who's got problems with Achilles tendons on both sides, please also make sure that they're under a rheumatologist, because they may well have a condition called psoriatic arthritis or something related to psoriatic arthritis, which has got a very long name called, I'll say the name and then you can instantly forget it, called spondyloarthropathy, which is another inflammatory condition that you may well commonly see, and it's often missed. So that's it for the pictures, I think. What's next, Marc? Let me just tell you a little bit then about the most common form of arthritis, which is osteoarthritis. These hands look pretty dramatic, don't they? But the abnormality is really in just the small joints of the fingers there. They look very, very knobbly, and these joints are just affected by osteoarthritis. Risk factors for this are increasing age. Sometimes hands like this run in families. Being overweight is very important, especially in the weight-bearing joints. and osteoarthritis is more likely in people who don't do very much exercise or have had something like a football or a sporting injury, a broken ankle or something like that. Next one, Mark. Thank you. Okay, so in terms of the medical management of arthritis, there is not much to say about this, really, frankly, in particular in terms of osteoarthritis. The only thing that medical management can help with really in osteoarthritis is treating the symptoms or surgery. Now, in the olden days, people with osteoarthritis used to be loaded up with all sorts of different medications, in particular anti-inflammatories like ibuprofen or naproxen, loads and loads of different anti-inflammatories, and painkillers, including paracetamol, codeine, all the way up to morphine, tramadol, oxycodone, all sorts of things. However, latest NICE guidelines on osteoarthritis that came out in 2022 caused a bit of a furore because NICE have acknowledged really that medical management of osteoarthritis is not really very efficient. And most medication has now been downgraded. So if anti-inflammatories are going to be used, they really should only be used for the minimum amount of time at the lowest possible dose, because these drugs can be very dangerous in terms of stomach effects, in terms of high blood pressure, and many of them can increase the risk of cardiovascular disease as well. So in terms of medical management of osteoarthritis, there really is not very much to offer. Sometimes rub-on anti-inflammatory gel can be helpful. Rub-on chili gel can sometimes be useful for painful individual joints, occasionally joint injections, but it's very much self-management that NICE are now recommending in the latest guidelines, which is absolutely as it should be. Once people have exhausted conventional medication, if you like, in terms of pain relief, then the only option really is surgery in terms of joint replacement. Now, clearly you can't replace a lot of joints if it's lots and lots of finger joints, so often it becomes a pain management approach for people with osteoarthritis, and we'll come on to that because there's lots of things that people can do to help themselves in terms of pain management, other than by taking loads and loads of pills, which don't necessarily do much good. Now, as I said earlier, in people with inflammatory arthritis, this is a problem where the immune system has gone wrong. And so the immune system has to be dealt with. And conventional medical treatment of inflammatory arthritis involves various, not necessarily immune suppressing drugs, but immune modulating drugs. And these you may have heard of drugs called disease modifying drugs. And these are all slow acting drugs, for example, methotrexate, which act to control the immune system that is driving the inflammation in people with inflammatory arthritis. And obviously, we sometimes use steroids in different forms, including injections into joints and steroid tablets by mouth if the arthritis is really severe. So people with inflammatory arthritis will need to be managed on a long-term basis in secondary care. The vast majority will be seeing a rheumatologist. The other type of inflammatory arthritis that we commonly see is obviously gout or crystal arthritis. And gout is caused by too much uric acid in the blood, which causes crystals to form in the joint. And you will know the stereotype of somebody with gout would be a largest man with high blood pressure who's drinking a bit too much and has got a very big hot red swollen toe. And that stereotype is not necessarily wrong, but it certainly is more common in people who have what's called the metabolic syndrome. In other words, people that tend to be overweight, have high blood pressure, high cholesterol, and various other cardiovascular risks. So the key with this, gout is a very, very easy treatment, a condition to treat. All you have to do is lower the uric acid, which can be done with medication. It can also be done with lifestyle, and that most definitely involves looking at alcohol in the vast majority of people who have got gout. So that's it in terms of medical management, I think. What are we going to do next, Mark? Okay, great. Arthritis myths now. Now, one of the most popular ones really is that arthritis, osteoarthritis, is wear and tear, and we use this term all the time, or degeneration. We use these words just to explain it. In fact, it's nothing like wear and tear at all. If anything, it's a regenerative process because new bone is formed, as I'll explain in a minute, rather than a degenerative process. Most people who are diagnosed with osteoarthritis think that they are going to have progressive pain and disability. I answered a question from somebody today who'd phoned in worried about her. She'd just been diagnosed with osteoarthritis of her neck, very, very worried about that and what that means for the future. Having osteoarthritis definitely does not mean progressive pain and disability. It can often cause pain for a while and then it can stop. The last one, which I think just about everybody who's diagnosed with osteoarthritis believes, is that they have somehow caused this themselves by either their job or by hard work or by sport, and that therefore they must stop doing anything that puts any kind of stress across their joints because they will cause more damage, and that of course is untrue. Marc's going to go into that in a little while. So on the next slide, I'm just show you a little bit about what a joint looks like. I thought that might be quite useful. So this is the it's not a particular joint, it's any old joint. The brown bit is the bone. The blue bit, the dark blue, is the fluid inside the joint, which is called the synovial fluid. The pale blue around the edge of the bone is the cartilage, and that's like the rubbery stuff that protects the bony ends. It's like the kind of stuff that you can't eat when you pull the leg off a chicken, the really chewy stuff. Very, very tough cartilage. Cartilage doesn't have a blood supply or a nerve supply, so it cannot in itself cause pain. So lots of people think that when they get osteoarthritis, which is where the cartilage starts to wear out, it's cartilage that's causing the pain, which is in fact not true. The pain is coming from other structures around the joint. For example, the ligaments and the membrane called the synovial membrane that lines the inside of the joint. That's a very thin, slippery membrane. Normally, you can't really see it. So, what actually happens in osteoarthritis is that there is inflammation inside the joint. The synovial membrane becomes inflamed. There is increased blood flow inside the joint. And what that increased blood flow does is cause swelling and pain. And then on the next slide, it shows you what it does in terms of an X-ray. So the increased blood flow causes new bone formation. So if you look at the X-ray picture on the right and you look at the index finger, the end joint on the index finger, you can see that bone is obviously deformed. And there are two little hooky bits over the edge of the bone. Can you see those? And those are called osteophytes, which are new bone. And in the photograph there, which is one of my patients, she's got a lot of osteophytes in her middle finger. And that is actually a painless finger. It used to hurt, but it doesn't hurt anymore. So that kind of exemplifies my point, which is what I said, that the osteoarthritis can sometimes hurt at the beginning as there is inflammation. But as that inflammation calms down, it can often become painless. So it doesn't have to be progressive at all. So although it can look alarming, it doesn't have to necessarily hurt. So, what's the next slide, Marc? Okay, so now we think of these are pictures. These are called arthroscopy pictures, and arthroscopy these are all pictures inside a knee joint. So somebody has gone in there inside a knee with a little camera, and we're looking here at the surface. It looks like the surface of a planet, doesn't it? But it's actually the surface of the joint. So the top left picture is showing what a normal joint would look like inside, with lovely smooth cartilage in there. That's the cartilage, looks lovely and smooth. And the picture on the bottom right is a picture of a knee joint where the synovial membrane has become quite inflamed, and that is called synovitis. So this is osteoarthritis as well. So there is a lot of inflammation at the start in osteoarthritis, and that is why it causes so much pain. Next slide, Marc, thank you. Said that one already, haven't I? Can hurt at the beginning, but then it often becomes painless. So typically fingers would swell. I've got a couple of dodgy fingers at the moment. They swell up, and they hurt for a year, and then they stop. And nobody can tell what will happen. It might spread to affect other fingers, but it may well not. So patients can be reassured that this is not necessarily going to hurt forever. Next one. Okay, so this is a really interesting one that always surprises people. This is obviously this is a picture of one of my patients here, and these are his knees. And if you had to guess which knee was the painful one, you would guess it's the knee on the left-hand side of the picture, where there is almost no joint space at all. But in fact, the painful one is the other side. It's the left. His right knee doesn't hurt him at all. So this I put in this picture because it just shows that there is absolutely no connection between what you see on an X-ray and how much pain that people can feel. So X-rays and MRIs can look absolutely terrible, but there can be absolutely no pain. I busted my knee about 10 years ago in a stupid skiing accident, and when I had my MRI, I got really severe osteoarthritis in my knee, according to the MRI, but it was painless other than the injury that I just had, and I haven't had any problems with it. So terrible MRI can be painless, and normal joints can hurt a lot, which is the opposite side of the coin. MRI of the spine and of the low back of the neck and the spine is particularly useless. So just about all of us who had an MRI scan of our neck, even if we have no pain, will have a lot of abnormalities on the scan. So pinch of salt if you read an X-ray report that shows severe degeneration. Next one. Okay, so this is a really interesting point. So every day I speak to people who have been told that their bones or their joints are crumbling, or they're degenerating, or that they're wearing out. And I think if I was told that, I would feel exactly the same way, which is worried if I thought my bones were like crumbly cheese, or I was falling to bits, I'd want to sit on the sofa all day long and do absolutely nothing. And that's what people tend to do. Now, they've actually done this experiment where physiotherapists were asked to use negative words in terms of describing to patients what their joints were like. And not surprisingly, those patients had more pain than ones that were encouraged or said, no, this is normal, or it's normal for age, and there's nothing to worry about. So I think it's really important that we are conscious of what we're saying when we talk to our clients, and don't use these kind of terms, because people really take them to heart. And I almost every day, as I said, I see 30-year-olds who've been told they've got degeneration or crumbling bones, and it really, really affects people's behavior. So we just got to keep an eye on that. Next one. Excellent. So Marc's going to talk in a bit about exercise. So there is no good evidence that exercise damages joints at all. We know that some people who do very heavy work, for example, farmers and construction workers, for many years, are more prone to get osteoarthritis of the hips and the knees. But absolutely no evidence that for the majority of people that do exercise, there's any harm going to be caused. And in fact, some evidence that people that do less exercise might be more prone to needing joint replacement than those that do exercise. I think it's you now, Marc, isn't it? Yeah, you're going to talk about exercise, aren't you, first? And then I'm going to do that one. Are we not? Or should I do that one? Let me talk about this one first. Let me tell you a bit more about exercise, and it really will be Marc. This is an MRI picture of a knee. So the dark bit at the top is where it's letter A. That's the femur, the top leg bone, and the white bit in the middle is the joint space. If that green arrow is pointing to a white area within the bone, now that is called bone marrow edema, which basically means swelling inside the bone. Now this is I think this is a chap in his 50s who has signs of early osteoarthritis in his knee. This is the earliest MRI sign of osteoarthritis that we can detect. And what these researchers did was to take a group of people who had never run before, in their 40s and 50s, and they somehow, God knows how they did this, but they somehow persuaded them to train and run for a marathon, which they did. So they've got MRI scans of before the marathon and after the marathon. And this is a chap who's got signs of early osteoarthritis in his knee. And the picture on the right is this remarkable picture after he's done loads and loads of marathon training, run thousands and thousands of miles, and done his marathon. And sure enough, that edema has gone. So he has cured himself of his early osteoarthritis. So this a holy grail, and should we be all getting on our joggers and going out and doing a run? But a very interesting study and emerging evidence here that exercise can actually be really good for maybe even preventing osteoarthritis. I think that's it from me now, isn't it,
Yep,
Marc?
thank you, Wendy. Sorry,
Thank you. So sorry.
It wasn't deliberately leaving you hanging.
I went off piste a bit there. Sorry.
No, it's all good. It's all good. Yeah, so no, I just want to, yeah, it's a good point to carry on, because this is where I think it becomes like a very relevant point to start talking about exercise and activity for arthritis. Because essentially, if you look at the diagram on the screen of someone's knee, you can see that this works for every joint in the body as well. If you think about, whether it be elbow, your knee, we'll stick with knee for now. All the muscles, say in your thigh, but they will connect to the bone below the knee, and all the ones below in the shin and the calf, they connect above it. So what they do is they basically form a natural brace surrounding all of your joints. So basically, the stronger those muscles are, the better supported your joint is going to be, especially if it's affected with arthritis. As you've seen from the other pictures, there can be a lot of swelling, a lot of inflammation. There could be, various different problems sort of within there that Wendy's already gone through. But one thing that can really help to stabilize it, and there's a lot of evidence to show that it can actually reduce pain in the joint as well, is all done through increasing the strength surrounding your joints. So increasing your muscular strength is a really, really valuable thing to do if you have osteoarthritis, especially. There's also other things with other types, like with rheumatoid and so on, just like the increase in blood flow and things like that can really sort of tend to help some of the joints as well. But by increasing your muscular strength, one thing to add as well, I'm using the term exercise and activity here because exercise gets a really bad rap. And I know that puts loads of people off because people have various sort of references to it. Maybe it's PE at school, or you're picturing people in spandex doing aerobics, or big hench lads at the gym being bodybuilders, whatever it is. The things, exercise is a really varied term, and that's what, so I like to use exercise and activity as the same thing, because they are really. There's not really a difference. It's more about your perception of it. So anything that is an exercise or an activity will help to strengthen your muscles as you sort of do things with them. And I mean, the benefits of they're so huge when it comes to this. I mean, just from the list on the screen, you can see you'll get less pain from it. You'll have a reduced risk of injury because obviously if your muscles are stronger around a joint, they'll be better supported. You'll have increased mobility, your increased balance as well. And especially when that comes to things, especially say in an older generation as well, things like falls prevention can become very relevant. And if you have, better balance and your muscles are stronger around there, you'll be able to right yourself quicker. If you do tend to fall, there's a bit more protection around there as well, because it does help protect your joints. And one of the most underrated things, I think, as well, is the ability to become more socially active. Because when it comes to exercise and activity, this is something we saw a lot during the pandemic, especially. People would tend to, if they have pain in a joint, will sit around a lot more. And the more you sit around, the weaker your muscles get. And then it gets to the opposite side of what I've just been talking about. So the weaker your muscles become, the less support they give, the more pain you're likely to have from a joint. And your mobility starts to decrease. And if you think about it, the basis of pretty much everything we do is rooted in some level of strength. Now, I'm not saying you've all got to get jacked and you've got to be bodybuilders and deadlift 500 kilos or whatever it is. I'm talking about functional strength and being able to use your body in whatever way is relevant to you and useful to you, because that's where sort of the basis of our ability to even become social comes from. Because if you can't get out of your chair and you can't walk anywhere and you can't do anything or leave the house, your social circle in your life can become incredibly small. Whereas increasing things like just your base muscular strength, innate, and the ability to, stand in the kitchen to do something, or be able to go to the loo unaided, or just, go out for a walk or whatever it is, can increase your enjoyment of life. And at the end of the day, that's really what we all want out of it, really, isn't it? So stop giving a bad rap to exercise and start doing some of it, because there's so many different types that you can do. Because I have been asked loads of times before, like, what's the best exercise for arthritis? And I usually give, as I often do, give very evasive answers. It's not because I'm a natural contrarian or anything, which I kind of am, but it's more because the exercise I like to give to everyone is whatever you enjoy the most. Because I could give you a list of really boring physio exercises that you absolutely hate doing, and you will find every reason under the sun not to do them. I'm not saying don't do your physio exercises. The physio's giving you exercises, please do what they say. But, you know, have a dialogue with them. If you hate them, then come up with something else. But for general activity and exercise, if you enjoy doing it, you will make time for it and you'll do a much better job of it. And therefore, you'll end up with much better results from it. It's like, you know, if you hate cycling and someone tells you you've got to go cycling every day, you're going to be miserable. And it's always going to be like, oh, I've got to pick the kids up from school, got to get the washing in. You know, the sun is in the wrong position for me currently in relation to the moon. You'll find whatever reason you want to not do these things. But if it's something you enjoy, you'll actually make time for it. And there can be loads of different types of exercise and activity that you can do. Like starting, like I said, with aerobic, things like walking, cycling, dancing, even gardening. If you don't believe gardening is hard exercise, feel free to come round me to my mum's house and she will put you to task and you'll end up doing what I have to do. Resistance exercise as well. This can be anything from balancing on one leg, using weights, using resistance bands, or just body weight exercises as well. So there's a lot, you know, your body is like one of the greatest gyms you'll ever have in your life. And one thing that is actually very good, I know I say I don't like to recommend anything, but water-based exercise can be really good for arthritis because it can help to take some of the load off your body and, you know, still gets all the muscles moving. People with very, very limited mobility will have a lot of good results starting off with some aquatic-based exercises. I mean, it doesn't have to just be swimming, it can be aerobics, literally walking in a pool or just like doing movements within a pool can help, you know, your body to move, help improve the strength of those muscles. This is all assuming that you actually like being in water. Not everyone does. Everyone's different, which is why I like to say find something you enjoy doing and you will do. Even if that's literally just like, you know, going out for a walk, walking your dog, whatever it is, things like that really can make a massive difference. And if you or your clients or anyone have absolutely no idea where to start or what to do, I'll explain what this animated woman is doing at the bottom. So if you go to our website, we basically have a list of exercises that can be done seated. So they've all got a little gift to go with them to teach people how to do it, and split up into sections like legs, back, hands. So I've got like a sit to stand or a squat, which is possibly the most important exercise any of us will ever be able to do, because the ability to get in and out of a chair is really, really useful. You know, we do it all the time. Ideally, we would like to do it all the time if we can't. Things like, you know, limbering up your hips and limbering up your spine as well. Anything like that can be incredibly beneficial because exercise doesn't have to be really difficult or exhausting as long as you are using those muscles and using your joints. Yeah, motion is the lotion, essentially. So the more that you can do with them, the better your sort of symptoms are likely to be. Can't promise to cure them. That's not what I'm promising here. But, you know, your pain level should reduce. You should be able to have increased mobility to some extent, at least. And a shout out to my old friend flexibility, which is something that is ignored far too often, in my personal opinion. Things like yoga, Pilates, or Tai Chi, because another rhyme here, a longer muscle is a stronger muscle. And having improved flexibility can be a real beneficial thing, because that's another really big thing that can help prevent injury. Like a lot of times that people will injure like muscles or something like that is if, like, for example, you knock something off the table, you take a lunge to go grab it and then you throw your back out or something, which is all too common. The more flexible your muscles are in general, the more they'll be able to adapt to that type of strain very quickly. And it can just, you know, the ability to move without your muscles groaning because they're not used to moving in any sort of particular range of motion can be really beneficial, especially for things like back pain as well. As myself, I have arthritis in my lower back. I've had prolapsed discs in the past, and I've had all manner of back problems. And I found that like a lot of them, like things like sciatica and stuff like that, can be improved with just things like stretching, a bit of mobility and flexibility training. So I've given a couple of examples on the screen here of like a pigeon and a lying pigeon, also called like a figure four, where you can do these from a chair as well. I didn't find a nice picture to show the chair one, but you can do these ones seated as well. Basically just things like stretching out your glutes, which are, you know, that's the root of many people's problems is like if you just stretch out your glutes a little bit more, so much lower back pain and leg pain can be caused from there, because that's kind of like the middle zone. All the nerves run down your legs, is where it also goes up to your spine. If you can keep those muscles especially in good shape, keep them nice and flexible, it can reduce a lot of back pain and a lot of pain in general as well. So make sure that you're not neglecting your flexibility when it comes to these things as well. I'm not saying you have to be able to put your leg behind your head in like classic yoga fashion. There's loads of different types there, loads of free on YouTube, and just make sure that you're not neglecting that part as well. But enough of me lecturing you all on exercise, because there's still diet to get through. So there's a lot of myths, which Wendy's already mentioned, and there's always a lot of myths when it comes to diet and exercise. Like I think one that most people will probably have heard of is how you can't have tomatoes or nightshade vegetables or things like that when you have arthritis, because it will make it worse. You'd be happy to know that's not true. Tomatoes are very good for you. Vegetables are very good for you. I encourage you all eat plenty of them. But on the flip side of that as well, there's not one diet or supplement that's been shown to cure arthritis either. There are some little, gout is the tricky one in this, because of course you do have to watch your diet a little bit with gout, but with the rest of it, the main thing you really need to focus on is not worrying about, the two, because you can read so many things on the internet. Just focus on healthy eating and weight management. It's not a really cool answer, and it's not going to sell a million books. It's really simple and very basic advice, but healthy eating, portion size and moderation. Eat lots of fruit and veg. Just, you all know what healthy food is. Try to eat more of that and less of the junk food. I'm not saying you can't have junk food, mind. I am a realistic person. You can treat yourself to these things, but make sure they're treats, not something you're just doing every day. So yeah, just try and focus on getting a sensible amount of healthy food inside you, and focus less on elimination and fad diets. The fad diets are the bane of my existence, and they drive me absolutely mad. And there's always a new one coming out that promises miracle results and things that you can do, and it will make you live 10 years longer and make you more attractive to everyone around you, and or whatever things they're selling for it. But a nice example of this is, if anyone remembers the Atkins diet, which was all the rage once upon a time. And who's doing Atkins now? Yeah, nobody. So that kind of like shows these fad diets, they will work for a short period of time to help you lose weight, but they're not a sustainable lifestyle change. So therefore, it's not really going to help you in the long run. I'm a big fan of sustainable habits. And so making sure that you just start to introduce more fruit and veg if you're not getting enough of it. Make sure your portions are not too big, and just, being quite sensible about it. And try and stay off Google as much as possible. There's loads of places you can go for actual information from accredited sources. NHS, go to our website. We've got loads of recipes, fact sheets, and lots of information on nutrition as well. There's loads of places you can get really good information from. So try not to get sucked deep down into that rabbit hole on the internet of all these various things that claim that they can cure, or things are evil and so on, because a lot of it is rubbish. There's some good stuff on there, of course, as well, but loads of it is rubbish. A lot of it does come down to common sense. Healthy food, veg, eat the rainbow, eat all the wonderful colors of like the food that's out there, and no harm in treating yourself to some other stuff as well. One diet I will recommend though is, it's not so much a diet, it's more of again a sort of style of eating rather, is the Mediterranean diet, because that doesn't necessarily remove anything from your diet, but it does put an emphasis on some things that are very beneficial to your health, like oily fish, whole grains, olive oil, lots of healthy fats, grilled vegetables, things like that. So that's a nice route to go down, because again, it's all natural food, it's all good for you. And again, there's lots of information on our website if you'd like to read a little bit more into that one. But I will tell you a little bit more about some other dietary stuff I can help you with later on. But for now, I'm going to pass it back over to Wendy.
Thanks, Mark. I would totally agree with that. One of the main predictors of who will gain weight is people that are on a diet. So that's just proof that, weight reduction diets in general don't work. It's got to be healthy eating has got to be the way to go. So now I've got to talk about, almost literally talk about the elephant in the room, which is this problem. I'm 100% behind body positivity, but every time I see a poor person walking down the street like this, I think, oh my goodness, what is happening there with that poor person's knees? So there is no doubt that being overweight damages the joints. It just does. Our joints are not designed, our knees are not designed to carry 130 kilograms. Because of the way mechanics work, it's estimated that for every kilogram we are over, in inverted commas, an ideal weight, about another 4 kilos goes straight through the weight bearing joints. So, in other words, if somebody is 15 kilos overweight, say, which is not very much, that might be somebody that's only about 85 kilos for a woman, they're going to have another 60 kilograms going through their knee, which is like carrying another person on their back all day long, or carrying a 60-kilogram rucksack round all day long. And that is going to cause your joints to bend and frankly snap. So the other problem with being overweight is that it is a pro-inflammatory condition. And this is all the rage at the moment, isn't it? It's connected with the gut microbiome and things like that. Being overweight is an inflammatory condition, which is why people who are overweight also have more heart disease. And that's why people that are overweight have pain in their other joints as well that aren't weight bearing, like their hands and their wrists as well. And not a good thing, and a problem that is going to lead to increasing problems as the years go on. The rates of joint replacement are going to go up by 40% by 2030, I believe. So the good news about this, however, is that, next slide there, Mark, then, is that they have done experiments to see what happens to osteoarthritis pain in people that have taken the dramatic step of having gastric band surgery. Now, these people are obviously a BMI of over 50 is very, very heavy and life-threatening. So in these people, they managed to get their BMI down by 20%, which is an enormous amount. At 6 months, they had improved levels of inflammation in their blood, and more importantly, for what we're talking about, their pain had gone down by up to half, up to 50%, which is more than any painkiller known to man. The best we can do is usually about 30% with painkillers. Now, you don't have to go from that slightly depressing picture on the right, which is obviously, though, those kind of pictures are everywhere, aren't they? You do not need to lose that amount of weight to see the benefits. If you are 100 kilos, losing just 10 can make a massive difference. So even if you just lose 10% of your excess weight, that can help pain by as much as 30%. So it is not such a massive task. I think almost everyone can lose 10 kilos quite easily by healthy eating. And then the last thing that I want to talk about is to do with really about pain management and the mind. So let's just do that slide then, Mark. This picture on the right is what my brain looks like, I think. This is all about pain and the fact that pain is multifactorial, really. So pain is not just due to damage in the joints. The level of pain that we experience is almost more to do with everything else that's going on around us. So if we're upset or we're worried about something, pain increases. If we worry about the meaning of pain, the pain increases. So lots of people would go to the doctor worried that their pain means that they've got cancer, and then as soon as they've told it it's not cancer, the pain goes right down again. So worry about pain is very important. If we don't sleep, our pain threshold will go down. They've done that experiment, and we will experience more pain. What I haven't put on there is hormonal cycles also influence pain as well. So women, when their hormones are low prior to their period, they will experience more pain as well. What we believe about pain affects our behavior. So if we believe that pain is causing us harm, then we will moderate our behavior accordingly and do less. And so that's why it's so important for all of us that see people with pain to explain what pain is about. And sometimes pain is just pain. That's all it is. Now, I just think I've got 1 or 2 more slides now. Very interestingly, this is absolutely astonishing to me that in the Second World War they did studies of pain in wounded soldiers, and a third of them, these are people who've got life-threatening injuries, including limbs blown off, feel no pain at all, which is astonishing. And that's because the meaning of their pain is that they're leaving the war and they're going home. So it's the context of pain that's everything. And this is one of my patients, and look at his terrible joint. This is gout, by the way, which is very interesting that he's got unusual deformities in his hands. he's got painless hands, but he came to see me because everyone goes, oh my goodness, you better go and see someone about your hands. But he says they don't hurt at all. So context is everything with pain. So it's really, really important. The last slide now is that we explain the meaning of pain, we avoid negative language, and we try and persuade people to do things that can help calm their busy brain, because pain, after all, is experienced in the brain, and pain is not literally where it is felt. Pain is felt in the brain. So if we can calm our brains by whatever means, then the pain will be less. So relaxation will help, being quiet will help, having a calming hobby, whatever it might be, a puzzle or coloring or anything, will help. Talking therapies, for example, CBT can certainly help. And I think one of the most important things here is trying to improve sleep quality, because sleep and pain are directly related. If we sleep better, we experience less pain. Easier said than done, but worth working on. And then finally, exercise, not necessarily exercise for exercise sake, but exercise to release those endorphins and endocannabinoids that are so important to help us feel better. So I think Marc's going to talk now a bit more, aren't you, Marc, about membership, benefits of membership?
Absolutely. So I should probably tell you a little bit more about Arthritis Action and the stuff that we have to offer, as well, as we've just been talking about arthritis for now, which of course is important. But we are a membership charity, so don't worry, I've got free stuff coming as well. But as a membership charity, this is something that might be of interest to some of your clients or your patients, is for £25 a month or £20 for direct debit. Sorry. Yeah, 25 is per year. Sorry, it's per year, isn't it? You can get all this lovely stuff for your clients or for whoever joins. So you get nutrition and weight management consultations with our on-staff dietitian, who's also a strength coach as well. So he's a phenomenal resource, and you can talk to him as many times as you like. You get 2 subsidized appointments with an osteopath or physiotherapist per year. So we'll subsidize up to £30 per treatment. So that's £60 worth of treatment you get, all for 20 quid, which is quite phenomenal. I don't really know how we afford that. It's madness. You get priority booking on our events and our groups, and an individualized personalized pathway. So basically, this is where they'll get a bit more direction, a bit more sort of hands-on help with people, because like sometimes you don't know what you need to do, what works for me, what won't. So my colleague Terry will basically phone them up, go, let's try you on this, this, and this, see how you get on, and he'll keep checking in to find out that these are the services that you need and that their one's working for you. If not, he'll switch you to a different one, and hopefully that'll be more beneficial. You also get 2 copies of our members magazine, the opportunity to vote our AGM. We have a AA Connect service, which is where you can talk via the phone, because I know not everyone likes to do things on the internet. And that we can talk to a member about their arthritis and just like have a bit of a chat with them. And also a selection of online strength exercise classes as well. And don't worry, if people don't want to pay for any of it, we have loads of free stuff. I will, of course, send some links out to this to Kirsty afterwards. But, we have a selection of webinars with various guests and medical professionals joining us on that. We have Arthritis Action groups. These are basically where people can get together on Zoom, hosted by myself, and we'll basically have a conversation based around a topic. And it gives the opportunity for people with arthritis to talk to other people with arthritis. So that way they'll have someone who understands what they're going through. And also to share tips, tricks, and experiences that might help each other. We have an online self-management resource, which is full of loads of videos and information. We have the Arthritis Action podcast, again, hosted by yours truly, and often featuring Wendy as well. A few of the subjects we've mentioned today, like things like your hormones and things like pain as well. We've got podcast episodes on them. They're free on all major providers, so you can listen to them as much as you want. We do have one on podiatry coming up at the end of the year as well. And we've got a whole selection of online fact sheets. We have a WhatsApp service if people want to contact us via that, because I know not everyone actually wants to talk to a person, just like to message instead. We try and cover every avenue we can, and you can sign up for free to our e-news. So again, I'll send links over for all this stuff. So should you wish any of this or want to ask me any questions about these services, please do let me know. And thank you very much. So let's see if you guys have a few questions. I'll stop sharing my screen.
Lovely. Thanks very much, Marc and Wendy. I have unmuted you, so if you've got any questions and you want to raise your hand and then ask Wendy or Marc your questions. Otherwise, please feel free to use the chat and I'll read them out to Wendy and Marc. No questions yet. I think you've given everyone plenty of information tonight.
We've covered everything, apparently.
I think you've
Literally
covered everything. Myra's asking, does infrared work?
That's a good question. Infrared is heat, really. So it's just heat. It doesn't have an effect via infrared rays or anything like that on arthritis. But some people find that heat is good for their joints. So absolutely, for some people, what we'd say is whatever works. Some people prefer ice on their joints, and some people would like heat.
Marie's asking, Wendy, can you talk a bit about biologic treatments and its effects on osteoarthritis?
Biologics not really used for osteoarthritis. They're certainly not NICE approved for osteoarthritis, although biologic type drugs are coming through. So agents that affect various inflammatory substances in the joint. So traditional biologics that are used for rheumatoid would not work for osteoarthritis, for example. Is that what you meant by that?
Marie, have we answered that question for you? Yes.
Yeah. Okay.
Yes, she said
Thank
yes.
you.
Thank you.
Yeah.
Anybody else? Anybody else want to take advantage of Wendy and Marc while we have them here?
I wanted to ask you, Marc, about how we can get people exercising or being active when they are inactive. You know, if they want to start, say, what advice would you give them?
So other than finding something that you enjoy doing, but however, that can be a big step, as I know, because that's the one I kind of use. Like going from 0 to just going outside and doing activity is a really difficult one. Just getting people to literally get up and move slightly more can be one. A sort of ridiculous bit of advice I like to give a lot is even something as basic when people do sit in chairs for far too long, because quite often you'll be sitting there watching the telly, and I'm a big fan of people leaving the remote control by the TV, which sounds so counterproductive and stupid, but people will put up with almost anything except when something you don't want to watch on telly comes on. So if it makes someone stand up and walk across the room to go and get the control, that's something they'll do several times. And it sounds like such a silly little thing, but it can start to kind of plant that seed of getting up and moving a bit more. And just, you know, set an alarm on your phone or something like that to go off every 30 minutes and just basically do a lap of even if it's just your house. If you can only go around one room, then do that. Because I think an important thing to add is that it doesn't always have to be a really big thing. It doesn't have to be going out walking 10 miles. You know, if walking to the other side of the room is hard for you, then that's fine. Then that should be like, you know, just start to walk a little bit of the way, then walk back, have a rest, later on do it again, and build these things up in really, really small increments. And, you know, use things in your home as well. A nice little one to do is because stairs are a big issue for a lot of people as well. One thing I quite like to suggest is use just your bottom stair as like a little workout. So if you've got railings, you can hang on to it, walk up one step, then get back down on it, and then get back up that same step and back down on it. You can start to use repetitions, and it's something that you can log. You could then start to, when that starts to become easier, then use 2 steps when you're doing it. And you can very gradually increase these things over time. So I think just like incremental increases in activity add up to really big things in the end. And just try and have a little bit more of a take the stairs mentality if possible as well, which is one that I'm a big fan of, where unless, like, obviously if you do have, like, you know, say severe arthritis within your lower extremities, like stairs could be a big issue, so, you know, build up to that. But if you can walk around, you know, maybe take a little bit of a longer route to get a little bit more exercise in there. You know, take the scenic route, for example, you know, something like that. Just extra little bits you can add on to your day will start to add up throughout it. So it doesn't always have to be, again, this is why I say activity and exercise, because all of this is exercise. Anything that gets your body moving and doing things is going to increase your overall strength and your ability to move and your ability to function. So it doesn't matter how small it is. Don't ever, you know, no one should ever feel silly that they can walk 10 steps instead of 5. I think that's a huge improvement and a huge achievement, and these things should be awarded. You know, pat yourself on the back for this type of stuff, because anything that gets you moving or gets you doing anything, you know, reward yourself. Not necessarily with a cake or something like that, but you know, do something pleasurable for yourself afterwards. You know, if there's something you enjoy, okay, I did my stretches or my physio exercises or whatever. Now I get to watch my program on telly or something like that. You know, something to create a positive sort of thought from it, so it doesn't become a chore. Build these things into a daily routine as well. Like you get your breakfast when you've done your stretches or something like that. And you know, whatever one works for you. I know a lot of people who actually do it that way, and it works well for them because they want their breakfast, because they're hungry in the morning, so they can't have it till they've done their stretches. Well, yeah, whichever one works for you. I hate doing stuff first thing in the morning, so that won't work for me. So just like wherever it does work in your day, build it into your routine and make things, just start to move more and do more things. Anyone else?
No more questions, Marc and Wendy. I think on behalf of everyone, massive thank you for this evening. Thank you. Really, really interesting discussion. I know, Marc, you're going to send me some details and I'll forward on to everybody who's attended here, and then you'll all get your CPD certificates as well. Marc will get that to me tomorrow, so I will pass that on to you straight away. So again, Marc, Wendy, massive thank you from everybody here. Sinead commenting, thanks very much. Victoria as well, thank you very much. Lots of thank yous coming in. There you go. Not many questions, but plenty of thank yous. So thank you everyone for joining us tonight. Have a really relaxing, lovely evening, and speak to everyone soon. Have a good evening.
Thank you.
Thank you, everyone.
Take care, Wendy, Marc. Speak to you soon.